Samantala, sa issue pa rin po ng pagbaka sa COVID-19, makakapanayan po natin si Mayor Jerry Trenas ng Iloilo City. Good day po sa inyo, Mayor Trenas.
Good morning. Weng?
Opo, hopefully po ay maayos na ang inyong pakiramdam, Mayor.
Better na tinamaan ako ng pneumonia, na ospital tayo ng 3 araw. Nigyan akong antibiotics through IV. And better na. I am feeling stronger. It takes a while pala to feel better after you get a pneumonia bite. Mukhang
Ayun. Yun po, kasi sumasabay pa, no? Dahil sa ngayon po, medyo tumataas pa din po ang kaso ng COVID sa inyong lugar. Kumusta na po ba ang mga pagharap na ginagawa po natin dito sa pandemyang ito?
Well, we are still under MECQ. This will be 1 month and a half more under MECQ, because we were already under MECQ for 3 weeks. I have allowed the non-essential businesses to open up to 30%, except only spas, massage clinics, gyms, which are still prohibited under the omnibus rules of the IATF. I am already appealing to the businessmen to really understand the restrictions, because we have no choice. And I told them the real situation in Iloilo City. We have to all understand that Iloilo City is a regional center. Kaya't as a regional center, lahat na may severe or maybe moderate na COVID cases coming from the whole island of Panay, Antique, Capiz, Aklan, and the municipalities of Iloilo, together with Guimaras. Lahat pupunta yan sa referral hospitals ng Iloilo. Kaya very important, as I have always requested DOH, that we have additional nurses, additional personnel for the public and private hospitals, so that they will be able to treat more COVID patients who are moderate and severe. And even those with mild, if they have comorbidities like diabetes, high blood, cancer, dialysis, and the like. All our COVID beds are presently full. I have been in constant dialogue with the doctors. We need beds, additional COVID beds. We need personnel. PhilHealth has to pay. The hospitals, I think it was 860 last March. I'm sure there are more right now. And ultimately, we need more vaccines. Vaccines have been given to us, but only on a very limited way. As a matter of fact, we did not have any vaccination last week. And we were told only yesterday that we will be receiving an additional 10,000 doses of Sinovac. So we will be able to have another rollout, probably starting late this week up to next week. It has come also together with the schedule of the second doses for Sinovac. So we have to to do the injections for the second doses first, and then we proceed with the first dose.
Mhm. Mayor, so far po ngayon, dumating, sabi nyo nga po, nadagdagan na din yung bakuna, pero hindi pa din po sasapat, ano, dahil sa medyo marami yung kailangan po nating bakunahan sa Iloilo City. Pero doon po sa mga previous na nabanggit ninyo sa amin na kakulangan ng nurses at ng doctors at ng mga medical frontliners natin, did the Department of Health responded to your request already po ba?
The doctors requested for 125 nurses. DOH has given 50. There are already, I think, 10 uniformed personnel who are medical frontliners coming from BFP who are helping out in one of the hospitals. The city has hired 23, but some of them are still completing their papers. 5 of these 23 have already been dispatched to the hospitals. We hired also 44 nursing aides. One half of them have been dispatched to the hospitals. 22 utility workers. I think we were able to get 20 already, and they have been dispatched to the hospitals.
Mhm. With this number po ba, is it enough?
Kulang pa rin, no? Kaya ang hinihingi namin, sana ang DOH naintindihan ang sitwasyon sa mga hospital para matulungan na lang na maigi ang mga hospitals. Kasi ang tingin ko, tingin ng mga doktor, medyo tatagal pa ito ng konti. Hanggat hindi tayo nakabakuna ng isang segment ng populasyon natin, pareho pa rin ang cases, no? We need more vaccines because we really need to vaccinate the A4 sector because they're the ones going out, they're the ones earning a living, and eventually they're the ones who are infecting their senior citizens or children in their houses, no? Last night, my wife got a call from one of our friends in the barangays that her 7-year-old grandson was already infected. So you know, as in NCR, when you had community transmission, cases are really all over the place.
Mhm.
We try to contain it. I will have my own COVID team meeting at 9. We will talk about it again. But there is already community transmission. And ultimately, I think what we really have to do is, one, increase our hospital capacity, assume that we will be having more COVID moderate to severe cases, not only coming from the city but from the whole island of Panay and Guimaras. Prepare more COVID beds by getting more medical personnel. Prepare more COVID beds like remdesivir and the rest, which are needed for treatment of severe treatment of COVID. We need more ventilators and high flow oxygen cannula, and ultimately allow PhilHealth to pay the hospital so that they can better respond to the problem and more vaccines. If the IATF can allocate 220,000 doses of Pfizer to Cebu, we will also request for our proportionate share. While the Iloilo City has procured vaccines, 600,000 from Astra, 70,000 from Novavax. We were told that for Astra, only 15,000 will arrive starting July and another 28,000 in August. For the rest of the year, we do not have any idea how many will be delivered to us. For Novavax, they said that it will come starting last quarter of this year without any uh, schedule. We are going to approve today, this morning, additional funds for Covaxin so that whichever vaccine will be delivered right away to Iloilo, we can use them to protect our population.
Mhm.
We're looking at a total population of Iloilo 500,000 times 70%, that is 350,000. Plus another 100,000 for those who are working here but are not residents of Iloilo. So we are looking at a targeted population of about
Mhm.
450,000 people.
So, Mayor, wala naman po bang problema about the vaccine hesitancy in your area?
Ano, ang problema namin is
Kulang.
vaccine availability.
Okay. So, sa ngayon po, ano yung ibang mga strategy pa na ginagawa po ng local government to address this issue of the pandemic po?
Well, we open up more quarantine facilities. There are about 500 who are now in the quarantine facilities. We give food to them every day. There are also some patients who are already in the hotels managed by the hospitals. I think there are 5 hotels already where there are patients who need to be hospitalized, but due to lack of hospital beds are in different hospitals and they are managed by the nurses of the hospitals just to make sure that everyone will be given medical care
Mhm.
uh, in whatever nature or kind.
Oo. Mayor, kumustahin na din lang namin po yung inyong Vice Mayor dahil nabalita na nagkaroon din po siya ng infection?
Yes, the vice mayor, together with his wife and his children and everyone in his household, were positive. He called me yesterday that he is about to be discharged this
Mhm.
morning.
That's good news. Pero ang isa po sa nakikitang dahilan daw ng surge dyan po sa area ng Visayas ay yung mga gatherings at yung yung mga celebrations na ginagawa. So the people cannot parang they cannot avoid being apart from each other. Parang yung social distancing po ay doon nagkakaroon ng problema. Is it true po ba, Mayor?
Ano, since 3 weeks ago, we did not have any gatherings, any gathering of whatever nature or kind which come to our attention. People are asked to explain. And after receipt of their reply, necessary action will be given. We have not allowed any gathering of whatever nature or kind. If there is only any gathering when it's the vaccination, no? Because at the moment we already have 2 big vaccination sites. One at Central Philippine University, one of the oldest universities in the Philippines. Another is in the Iloilo Convention Center. It's a big site. It's the iconic convention center in Iloilo City. And the third, which we are going to use this year, is the gym of the University of San Agustin. Again, one of the oldest universities in the Philippines. These are very big sites. And we are using these sites because we will be able to ensure physical distancing even if there's a lot of people there.
It's been month-long fight, ano po, Mayor, dun sa naging surge po. Do you see any positive side na dadating po sa inyo sa mga darating na araw? Are you winning the war against this pandemic po ba?
You know, Weng, ultimately, ang malaking tulong ang vaccines. No? We have been promised by Secretary Galvez some vaccines. You know, what happened to the United States? What happened to Europe? What happened to the NCR? When there were several surges, ultimately what stopped the surges was the vaccines. Really, I don't think we need to be medical people just to understand that. Because once you are vaccinated, whether it's a Chinese vaccine or a Western vaccine, at least our data shows that none have died. No? You still continue to be infected, but you will not die of the virus. But people who have not been vaccinated actually die because of the virus. We have 5 deaths every 3 days. And they become part of the numbers after they die because we have left them behind, unfortunately, because of the lack of vaccines. We want to be vaccinated, and the Ilonggos are falling in line to be vaccinated in one vaccination center because they knew that all the first doses were about to be finished up. 500 persons just lined up to be vaccinated. It's really, there is no problem about vaccination and the acceptance of the people to be vaccinated. It's really the problem of the lack of vaccines. We stopped vaccination last week because there were no more vaccines.
Mayor, when do you expect your procured vaccines to arrive po ba?
Well, for Astra, 600,000 doses, we were told that July we will have 15,000 and August 25,000. They do not have any schedule for the rest of the year. For Novavax, it's supposed to come last quarter of this year. And then this morning, I will be approving another budget for Covaxin. They promised to bring in starting August 25,000. So really, we are really at the mercy of the national government in the meantime.
Ayan. Ako, thank you so much for your update po, Mayor. Do you have anything to say with the government po or any call for the government?
Well, I will repeat what the Western Visayas Physicians Association has said in their manifesto. they are requesting from Secretary Duque and Secretary Galvez, first, more vaccines. Second, more personnel for the hospitals so that more COVID beds can be made available, more COVID medication, more ventilators and equipment, and finally, more vaccines. We need to be able to take care of our people here.
Okay.
But we
So,
need the tools so that we will be able to take care of them.
yun. Thank you so much for your time, Mayor. Pagaling po kayo at sana ay patuloy pong umayos na ang sitwasyon sa inyong lungsod.
Yes, let us continue to pray to the Lord our God to make sure that we are guided insofar as the leaders are concerned, and for protection for our constituents so that they will not perish during this pandemic. Salamat po.
Yan. Good day po sa inyo. Ang atin pong nakapanayam ay si Mayor Jerry Trenas ng Iloilo City at sinabi niya nga ay they are at the mercy of the national government dahil talagang ang kailangan po nila ay bakuna. Ang inihalimbawa nga niya dito sa Metro Manila nung magkaroon ng surge at dumating ang mga bakuna, nagkaroon na ng mga vaccination rollout, ay umayos ang sitwasyon. At ngayon nga po ang Metro Manila ay naungusan na ng Visayas region doon sa mga mataas na kaso ng COVID. Pero ang sinasabi nga po ni Mayor Trenas, ang kahilingan nila ay maraming bakuna, dagdag na mga medical personnel, mga doktor, nurses, dagdag na mga gamot, at dagdag na mga ventilators at oxygen para doon sa mga nasa facilities na ngayon ay nagpapagaling po sa COVID at bumabaka dito sa virus na ito. At ang isa pang panawagan nila, noong unang nakapanayam natin, yun na din yung panawagan nila, magbayad na daw ang PhilHealth doon sa mga pagkakautang sa mga ospital para may magamit na sila para doon sa pag-aasikaso sa mga kababayan nating may sakit ng COVID. Ang iba pa mga balita sa amin pong pagbabalik.